Welcome to a PreventConnect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Next we have our third and last is David Lee, and David is talking to us about a movement to end sexual violence.
So we have a big task ahead, and we're really ambitious in what we're trying to do, because what we're trying to do is prevent sexual violence. And this is a task that's going to require us taking a road to create profound social change. And so we have to recognize that when we're doing our sexual violence prevention work, how profound that is and what change it involves. And so I'm really excited to be part of, with PreventConnect Calcasa, to be joining with the National Alliance to End Sexual Violence and the National Sexual Violence Resource Center in launching Reliance, which has a really broad and bold goal to end sexual violence in one generation. And when you say it that clear and put it in your logo, you know you're being bold and being clear. And all of us in our rape prevention education programs are being very bold in what we're trying to do. We're trying to do something that some people feel they can't, but we know we can do. But we are bold in trying to create that change. But as we go on this pathway to change, it's ambitious, yet necessary, but we need the key tools to do this. And we need to find that range of tools. So we have to ask ourselves, what tools do we need to prevent sexual violence? So what I'm going to do now in my next 5 minutes and 21 seconds is to share my personal path to prevention, where I've gone, and to be able to look at some of the insights that I've had, to identify the tools that I've used, and to encourage you to think about which tools that we're going to have in our repertoire to be able to create this change that's so necessary. Now, many of the tools for me came from feminism. And I learned, and I was inspired, and I was taught, from starting with the voices of survivors, to meeting early feminist activists, to being able to look at ways that we saw that women took the lead in this work to be able to say, we need to do something different. And this continues today as we see new feminist action. Recently, I was inspired by the work of the Black Women's Truth and Reconciliation Commission, where we were talking about African-American women and sexual violence. And I've been inspired by many books, whether they're old and newer books, that have been able to teach me about the writing, and from this feminist organizing and work that built the movement that so many of us come from. I also was inspired by men that were doing this work. And I started doing this work in the early 80s. And when I started doing this, I had the opportunity of meeting other men who were going over and doing this. This is a brochure, a flyer, for the first demonstration I ever went to of men speaking out against men's violence against women and girls. And it was actually organized by Craig Norberg-Baum, who is going to be retiring very soon from Jane Doe in Massachusetts. This was in 1985 in St. Louis, Missouri, Brother Storm. And it was a way that I saw another way of creating change, and a movement that we can be able to move forward, of being inspired by the women feminist leaders and by men that are saying we have to be able to do things differently. And it was an important part where I learned much about how I was going to do the work. Yet in doing this work, I was looking for other sources. And the next source I went to was public health. And it became very interesting. In 1985, I learned about the then Surgeon General. See if anyone recognizes this picture. I had someone say, "Who's that?" So C. Everett Koop, for those who don't remember. And then there was having a workshop on violence as a public health issue. And it surprised me at the time, because at the time I thought public health just dealt with, closing restaurants that serve bad food. But I realized the tools that public health would bring. And this led to me to an exploration and beginning to learn more about public health messages and approach that, and eventually leading for me to get my master's in public health. Go Bears. Not many Cal grads here. Okay. And then I've seen the field of public health and sexual violence grow. In 2004, when we saw beginning the dialogue, it posed some of the definitions and thinking, but yet I've seen the maturation of our public health infrastructure and being able to address these issues. And when we come to now, in 2016, with the Stop SV technical package to prevent sexual violence, shows the maturation of what we've learned, how public health provides us tools of surveillance, understanding behavioral theories, evaluation and research to be able to make population-level changes. To me, this aligns with what I learned from the feminist movement, what I learned from men who were doing this work, and it was talking about doing community-level change and how we had to go beyond working one individual at a time, but to think about how we were going to change that community as a whole. So throughout my career, and here's logos of every organization I've ever had a paid job at, an unpaid job, that I have been working to try to combine the tools of activism with public health to be able to create that change. And that this is a way that has been working to be able to try to move forward. My path has taken a new road in the last year and a half, and it's been really exciting and perhaps the one that I'm learning new things, and where I'm learning new concepts and old concepts that I'm relearning as new concepts. And so I've had the opportunity of being involved in Move to End Violence, which is a program of the Novo Foundation. And Move to End Violence is a 10-year initiative to build the movement and strengthen the movement to end violence against women and girls in the United States. And I've had the opportunity to be joining in the third cohort, and these are my colleagues, and they're dedicated to ending violence against women and girls, working to end sexual violence, working to end intimate partner violence. And there are people that are involved. Perhaps some of them are focusing on women's empowerment, on men's accountability. Some are working in media advocacy. Others are working in prison reform. Some are focusing primarily on immigrant rights. Some are working on addressing economic justice. Many are using community organizing strategies. And together, we, as a group we use the term comrades as we are with each other, of being able, you'll learn about my next path, are going over to be able to think about how we're going to do this change. This road's taken me in places I never thought I would go. If we're thinking about a movement, we're actually talking about how we embody movement and even looking at how we move to look at how we are a movement. So here I am doing Tai Chi with my colleagues. If you know me, that you would have never guessed. My path also took me to South Africa, where we went on an international exchange. We're getting an opportunity to be able to learn with activists. I was in South Africa, so I'm going to show you the requisite animal pictures. That is a hippo in the water. Ooh, ah, ooh, ah, ooh, ah. But when we went to South Africa, because we were meeting people in a country that's gone through tremendous, profound political and social changes. As we saw a movement that was, for generations, a movement to end apartheid and the change that's happened in that country, and looking at how they were being able to create change and to be able to learn. And we had an opportunity to meet activists throughout the country who are doing work to ending violence against women and girls and learn from their experiences of how they were creating that change. To me, this aligns with what we see in public health. And Jim Mercy referenced this earlier today when he was talking about how we need to learn from some of our international examples to be able to create change. Unfortunately, he has a competing roundtable discussion after lunch, which I would have gone to, but come to either one or any of them. And so we need to be able to learn, and so we look from these reports. So we need to be paying attention to perhaps, for example, I put the SASA study over in Uganda of doing community mobilization efforts, because those are places that are looking at how we are doing community-level change and being able to do those in ways. Now, the conditions are different, the situations are different, but we can draw on the lessons. It's the most exciting work in what in the international world we talk about as gender-based violence is taking place not necessarily in this country. Many of them are, but there's a lot that's happening elsewhere, and we need to learn to expand our horizons because those are the tools that are going to move us forward. Now, Move to End Violence, there's 5 core elements. And these 5 core elements are looking at transformational leadership, organizational development, movement building, social change, and liberation from oppression. And so I'm going through a rather intense process looking at each of these and spending time. I want to spend time thinking about the movement building piece, because the work that we're doing in our RP programs in our states are part of movement work that's taking place within this country and throughout the world, and we need to think about and learn from the movement work to be able to help strengthen our work. In MEV, they've identified three. They use the term pivot, which once it comes to the movement thing, think basketball on pivot. How many of you are basketball folks? Or you keep one foot rooted to the ground, but yet move around. I'm trying to demonstrate my pivot. Okay, I don't have moves. These pivots, I think, align with what the RPE program is doing and what we need to think about where we can expand in our rape prevention work. The first pivot is about being proactive, and that we need to move from being reactive to proactive, pursuing a bold vision for change. I see RPE, with its focus on primary prevention, as being fundamentally proactive in being able to create that change. Now, part of being proactive to me is being able to draw on how we center and think about our work. And so we've been looking at the Gandhian concept of the last girl in being able to center our work on those who are most marginalized. Let me give an example from public health of where we did this just in the last few weeks. And so we saw that this CDC, along with other federal partners, releasing the Lesbian, Gay, Bisexual Youth Surveillance Report, highlighting how LGBT youth experience higher rates of sexual violence, and how that is a call for action to think about how we're going to address our work. We need to be doing more of this to be able to think about how we're going to move forward. The second pivot is about being interconnected, and that we need to move from a fragmented field, working in silos, to an interconnected movement that exponentially has greater impact. Now, we've been able to do that in public health, and the document of Connecting the Dots, I think, was a wonderful way of looking at shared risk and protective factors across 5 areas of violence, in a way to be able to move forward. But we have to go further than that. We are going to have to be able to think about how we are going to create interconnections to chronic disease, how we're going to make interconnections beyond health outcomes, but moving to other social issues. We have to look at the connections that we're going to make to social movements like the Black Lives Matter movement and the economic justice movement. I was really impressed in looking in the Stop SV technical package to look at all the different options here, and in particular I want to highlight O. Provide opportunities to empower and support girls and women with strategies to strengthen economic supports for women and girls and strengthen leadership and opportunities for girls. This aligns with a lot of movement work that's going on that might not be basing its work in public health, but yet basing its work in creating social justice to be able to address the inequities that aligns with public health principles. And if we can bring those together, we are going to go further. Because this takes us to pivot 3, social change. We need to move from a primary focus on meeting the immediate needs of people impacted by violence to an integrated approach that combines services and social change. To me, RPE is about social change, that it actually is creating a dedicated funding stream to go beyond services to those directly impacted by violence and focusing on changing social norms, and that we have to be able to think about how we are going to be able to get there. I've had the opportunity to do work with Movement Strategy Center, who highlights these 4 different visions in this report, Practices of Transformative Movements. We'll be talking about this in the pivots in the roundtable discussion to think about how these are pieces that we need to think about. In the last several years, I'm seeing more people who are involved in the sexual violence movement involved in these discussions about movement, being involved thinking about how we're part of movement. I think a lot of this is the leadership of Kelly Miller from Idaho Coalition and Nan Stoops from the Washington State Domestic Violence Coalition, and that many of you in the room have been part of these discussions, and I'm seeing a renewed, excited energy about where we can go and how we can be able to move forward. In fact, the Movement Strategy Center is going to be having a series of web conferences that are going to be starting in September, which is next month. So what's your path to prevention? What tools are you going to use? And it's thinking about how we can expand our repertoire. We can't rely on only one set of tools, and when you have such a bold vision of seeking to end sexual violence, that we have to find a way and invite you to be able to think about how we can expand that repertoire, because that's how we're going to be able to move forward. So go ahead. I see you all as being part of a broader movement, and that we create the change that we want to see and the change that we need to be ourselves, so we can work to prevent sexual violence. Thank you.
Thank you for listening to this PreventConnect podcast. PreventConnect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on PreventConnect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about PreventConnect, visit www.PreventConnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.